Although Serbia has fewer than 1,700 confirmed cases of COVID-19 and only 39 deaths as of Monday, according to the World Health Organization, Chinese doctors have arrived in the European nation to help prevent further spread of the virus. Critics have argued that the sudden show of friendship between Beijing and Belgrade is one of convenience and that China is taking advantage of the situation to extend its soft power and diplomatic relations. But what do medical professionals on the ground say themselves? Earlier, I talked to one doctor on the front lines, Cailan, Director of Department of Psychology of Guangdong Provincial People's Hospital, to find out. Dr. Ho, thank you so much for joining us. First of all, help us understand the situation in Serbia at this moment. I understand the confirmed cases at this moment stand less than 800 and about a dozen people have lost their lives so far. But according to your observation, how severe is the situation in Serbia?
Okay, thank you. And under the leadership of the government, actually, with joint defense and control from different departments of the country, and many measures concerning prevention and control of the virus carried out very rapidly. And the president is very anxious about the situation. And after we came back to Serbia and we communicated with the government, including the Ministry of Health and the Ministry of Defense, National Defense, and they did a lot of work in very short time. According to the experience of China, and they agree the experience. For example, they set up a shelter hospital in the capital of Serbia, and in a very short time, and there are about 300 beds in the capital, and yes, and now it's about 55 patients with mild symptoms lived in the shelter hospital and get treatment.
All right. Well, help us understand why Serbia. I understand China has sent teams to Iran, to Iraq, to Italy, which is very badly hurt, and to some other countries, to UK, for instance. But why Serbia? Because the cases there obviously not in a great number, and yet it seems that there has been a lot of attention paid to this country.
And I think perhaps there are some reasons, because in Serbia there are very limited ability of testing. Also, the number is not very high, but they just tested 3,500 in the country. I think perhaps there are some reasons. Firstly, because the severe shortage of the testing ability in the country, and there are just one organization can test the virus. So perhaps it limited the number of the patients. Perhaps with the increasing of the ability of testing, the patients will be more.
So what kind of expertise does China share with Serbia at this moment? I understand there are 6 members in the team that you're in at this moment, and also you brought quite an amount of medical equipment and supplies. So what are you sharing with the Serbian counterparts?
Yes, our team is consisted of experts, including emergency department, public health, and the department of infectious disease, and the department of respiratory. And the work we did with Serbia, we share the experience, especially in the prevention and control of disease. For example, I'm a psychiatrist. I share with the experts about the experience of the practice in psychological counseling and psychological crisis intervention in the process of against of the epidemic. And the experts from the public health, they share the experience how to fight the patients when earlier. That is to say, they want to they want to do the early identification and early diagnosis in order to do early isolation and early treatment, so as to reduce the infection in community.
According to China's experience so far, do you think the Serbian authorities and the Serbian health system and the general public are understanding the severity of the situation and doing the right things to protect themselves? For instance, the general public, do they have a high awareness that they need to stay home, that they need to wear a mask when they go out, especially into crowded places? Are these precautionary measures being taken and being implemented effectively?
Yeah, and we learned the knowledge from the government and from the media, and that population pay attention to the virus and know the importance of how to do and how to wear mask, etc. And the government imposed the curfew throughout the country from 5 p.m. to 5 a.m. on working day. And the president said if the situation of Serbia becomes worse and the curfew will be more strict than ever, and they want to impose the curfew about through the country one day.
What about the local Chinese community, Chinese students or people of Chinese descent or Chinese employees working in Serbia? Are you doing anything for this group of people as well?
Yes, and the Chinese, the experts team and have communication with the local Chinese, and we share the knowledge how to defend ourselves, and we give them some books and for example the psychological counseling or how to do in their home, and they perhaps they think it's very useful. And on the other hand, we give them a lot of video of different kind of knowledge, for example, psychology and public health.
Right, and there have been a lot of discussion about the intention behind China's humanitarian assistance to countries such as Serbia, to other countries. How do you look at your role here? How do you look at why you are there doing what you're doing?
Especially because the virus is very, very serious around the world. I think the collaboration between countries is very important. We must find ways to do because we can protect ourselves. And because of the friendship between China and Serbia, and we have the responsibility to improve their behaviors and improve their behaviors against the virus.
And finally, there are still a lot of people who are in less developed countries in the global south, for instance, who are looking at this virus, which are going to affect them very severely. If you can say something to those people, what would you like to say in order to better prepare themselves, both in terms of diagnostic or treatment, not getting this virus, and also from a psychological perspective, how can they help themselves to stay calm and be strong so that they don't compromise their immune system?
I think it's a very good question because the crisis because around the world, and perhaps people population feel very angry and phobic about the virus because they fear of death and other things. But sometimes influencing their sleep or other things. And on the other hand, because the isolation perhaps lead to the social isolation, and they feel restless or they feel not feeling of safety. And as perhaps we have to do something to adapt according to the changes of situations, because we must stay at home for a long time. And the lifestyles perhaps changed. We must change the lifestyle according to the situation. Perhaps we find something interesting, and perhaps we find sometimes to do. We have no time to do it before. For example, they will do some cooking, and we have more time to live with our family members, and we can do some movement. And on the other hand, we must have a good sleep, and they can be good for our health.
Thank you so much, Cailan, for your time and for your generosity. I wish you all the very best and good luck with your work.
Thank you.
My recipe is cooking and plants. And with that, we come to the end of this edition of The Point with me, Liu Xin. As always, follow me on Facebook and Twitter using the handle The Point with LX. Download the application called CGTN to watch the show on your mobile devices, or go to YouTube and look for CGTN The Point. Thanks for watching. You've got The Point.